Okay, so my case study presentation is on leukemia. Leukemia, or most people call it blood cancer, is a specific type of cancer that involves the body's blood-forming tissues, including bone marrow and the lymphatic system. There are many types of leukemia, uh, where some forms are most common in children, and there's other forms that occur mostly in adults as well. Um, Leukemia involves the white blood cells. Uh, in the body, the white blood cells are basically infection fighters, and they normally grow and divide in in an orderly fashion as your body needs them. But in people with leukemia, the bone marrow produces an excessive amount of abnormal white blood cells which don't function properly. Leukemia is thought to occur when some of your blood cells receive some changes, or the like the medical term would be mutations, and uh, those mutations occur in the blood cell's genetic material, or DNA. In a normal person, the DNA tells the cells when to grow and when to die, or basically divide. With a patient who has been diagnosed with leukemia, the changes of the cells, the changes or the mutations of the cell tell the blood cells when to grow and when to divide. Some different types of leukemia. It can either be diagnosed as acute or chronic. When I say acute, I mean the disease progresses rapidly and creates immature blood cells. And when I say chronic leukemia, it means it progresses more slowly. So I have here four different types of leukemia. Uh, I have acute lymphocytic leukemia. Obviously, it's a type of blood cancer that affects white blood cells, and the cancer starts in the bone marrow. So basically, near like right where the spongy bone is, uh, wherever the disease is located. Um, Next, we got chronic lymphocytic leukemia. Uh, it's where it begins in the lymphocytes of bone marrow and extends to the blood. Next, we got acute myelogenous leukemia. Is is basically when an abundance or an excess of immature white blood cells, or myeloid line of blood forming cells is made by the bone marrow. Chronic myelogenous leukemia. Most of the time, this is caused due to an acquired genetic defect, a defect, I mean. Uh, from this causes bone pain, fever, night sweats, easy bleeding, fatigue, and weight loss. Some basic symptoms of leukemia. Uh, the symptoms may vary from patient to patient depending on the type of leukemia that they're diagnosed with, but some common signs and symptoms include fever, chills, or any kind of like feeling like you're like constant fatigue and weakness. Also, some severe infections that appear frequently. So basically, when I say that, it means basically infections that pop up uh, more constant over time, and you get more infections than the average person. Uh, when your lymph nodes start to become swollen, that would be another symptom that most people get when they've been diagnosed with leukemia. Easy. So when someone gets cut, they bleed very easily, or also they bruise very easily if they fall, or any other way they'll get a bruise. Uh, that becomes easy for them. When they start to have tiny red spots that appear on their skin, and when their bones become more painful and more tender to things around them. All right, so the diagnosis of leukemia. Doctors may or may not find uh, chronic leukemia through like people's routine blood tests that they get every so often. Uh, Most of the time, uh, they may or may not find them before symptoms start to come up, but most of the time they won't find out if they have been diagnosed with leukemia until the symptoms start to come in. So some tests that can be used to diagnose leukemia if symptoms do come up. One would be just a physical exam. This is basically the most simple you can get when it comes to deciding if your patient has leukemia or not. Basically, just to look out for pale skin. You can feel around the lymph nodes to see if they're swelling up, and also enlargement of the liver and spleen. Another test you could do are just normal blood tests, and from here the doctor can determine if you have an abnormal amount of red and white blood cells, as well as leukemia cells too, to make sure if they're growing that we need to make a stop to that and try to narrow that down as much as possible. Uh, and also a bone marrow test. This is basically a procedure, so it's like a surgery to take a piece of bone marrow from the hip bone. Uh, Basically, it's taken from the hip bone because it's probably that's the largest mass. So you'll get a decent idea if there are any leukemia cells in that bone marrow to see if they have leukemia or not. Some treatment for leukemia. Treatment for leukemia depends on many factors. Most of the time, your doctor determines your treatment options based on your age and overall health, the type of leukemia you have, and whether it's spread to other parts of your body or not. Some of the basic treatments that most people use to treat their illness. One is chemotherapy. This basically uses lots of chemicals to help kill the leukemia cells, and it's probably the most common treatment used. Uh, this is the same method that my aunt used when she got diagnosed with leukemia, so I know that from personal experience that it's very useful and very helpful. Uh, we got radiation therapy. This uses X-rays or other higher energy devices to damage the leukemia cells to help basically stop or stun their growth so it doesn't overtake on the body. And also a bone marrow transplant. Uh, some other people might call it stem cell transplant, but people call it bone marrow transplant as well, which helps cure stem cells by replacing the unhealthy bone marrow with leukemia-free stem cells. All right, so how leukemia is affected from exercise. I have some things listed here that I found while researching this topic. Uh, but just regular physical activity has been shown to benefit people with leukemia in many ways. So basically, staying on your feet, staying active, staying moving around, not staying sedentary. It can improve your quality of life of those with leukemia who are in the process of getting treated and after treatment. Um, by by being physically active, it can reduce some of the symptoms that arise if you're diagnosed with leukemia. Some of them include reducing fatigue and reducing the amount of sleep problems that may arise during this time. People with leukemia who exercise regularly report better physical function, improved mood, and increased self-esteem. Uh, some of the treatments that are recommended are only for people who maintain an active lifestyle. So, being in good shape and taking care of your body can really open your options for treatment and also speed up the recovery process as well. All right, so the case study that I came up with. Uh, so we had this patient who's a 35-year-old male who's been diagnosed with acute lymphocytic leukemia. He's been diagnosed with it for about 3 years. He's currently trying to seek treatment and trying to find the best possible way to help him fight this disease. His doctor has given him the okay to resume moderate intensity exercise without exceeding moderate intensity exercise. and nothing should be done too vigorously that would put too much stress on his body. So some of the risk factors that could come up this patient has been while this patient is exercising. Uh, the constant muscle fatigue, those symptoms are very that they can come up very frequently in leukemia patients. So we just basically have to keep a close eye on that just to make sure that it doesn't damage any of the muscles in his body by working too hard. Also, most patients who have been diagnosed with leukemia get frequent nosebleeds. So just gotta make sure because most people get nosebleeds from super dry environments. So you just gotta make sure the environment has a lot of not dry air, but enough to make sure that he feels comfortable in the environment. Some goals I would say for him just to stay active and maintain a healthy lifestyle, as it will help him out in the long run when it comes to fighting this disease. Because staying active and staying healthy will go a long way. All right, so exercise testing and prescription. So for cardiovascular, I looked this up online. A cardiopulmonary test will be good to measure his VO2 max as well his exercise ability. This would be good because it kind of give us an idea of like what he can do and how long he can do it for. For resistance, I kind of just went out on a limb and said 1 RM max squat, just a basic strength test to test his strength. And flexibility, I do sit and reach test. All right, so now for the prescription. For frequency, cardiovascular about 2 or 3 times per week. Same thing for resistance, 2 to 3 times per week, and flexibility 1 to 2 times per week. For the intensity, I have them all at moderate because in the case study it says the doctor said did not exceed moderate intensity. So moderate, we can start off at light intensity and then work our way up to moderate, just to get him out there and working out. All right, so for the amount of time for cardiovascular, about 30 to 45 minutes uh, per workout, or per workout per day. So for resistance, I increase it about for 5 minutes, just to gain muscle mass and things like that, and flexibility for about 15 to 20 minutes before and after the workout. And basically for the exercises we would do for cardiovascular, just basically basic jogging on the treadmill and using the stationary bike. For resistance, probably single arm shoulder presses by alternating arms, and just simple bench press. And for flexibility, just like dynamic warm ups, dynamic stretches, things like that, just to keep the body at ease. All right, so there's my references just for there, but this is my conclusion. Uh, so one thing I would like you guys to take away from this presentation is that exercising always helps, no matter what disease you have or what you're diagnosed with. Also, just doing simple exercises will go a long way in helping maintain your healthy lifestyle, and it will help out your disease in many ways. Thank you.